can hear. Okay. So if Dr. Hassan is ready, we can start with the history.
Hi, Dr. Zahid, you hear me?
Yeah,
I'm
I can
ready.
hear you. Your voice is a bit slow, but I can hear you. So you are ready, yeah?
Yeah, I'm ready. Yeah.
Okay. So just a brief about me. I'm Zahid Gull. I'm basically from Pakistan, and I'm currently working in UK as a registrar in neonatology. I have worked before this in Saudi Arabia as a registrar, and then I was working in UAE before moving to UK. So for now, the today's session is focused on history and communication. But if anyone has any question regarding how to move to UK or how to do GMC registration, so I will be more than happy to guide you regarding that.
Great, great.
Yeah. The screen is visible, yeah? So just a general advice before starting any station, especially for the history. Try to read the scenario properly at least 2 to 3 times. Write down the names on the top so that you will not forget them, because especially in exam situation, when you are in stress, you forget the names. Okay, write down the important bits in bullet points so that you know that what you have to cover. I used to write all the history points, history headings, because when you are in exam situation, you forget that you have covered the medication or no, you have done the past history or no. So try to write everything, 1, 2, 3, so that you know that you have to do these bits, and then try to cross them when they are done. Try to address the parents or the patient by name or agree with them some common word. Like people start calling them mom or dad. Maybe they don't like these words. So try to get a common name with them. Make sure not to confuse between he or she, his or her, as it's common during the stress time. Keep the parent at ease and respect if they ask any question. Don't ignore them. If you think the question is not relevant to the history and it will waste your time, still you have disturbance. Okay. I know my colleagues have spoken about the history, the timing, but just this an overview. First 4 minutes when you are outside the station, you have to prepare. You take your time for preparation. Take the things which I have talked about, that write everything. Then 14 minutes you are inside taking the history. And then 9 minutes you will be doing a viva with the examiner. Is it clear, Hassan?
Yeah, it's clear. Yeah,
Okay. Shall I go to the topic for today, the history topic?
right.
I will go to it and I will start my timer for 4 minutes, okay?
Okay.
You can read the history.
Yeah.
Okay, you can prepare. I will start
30,
with 4 minutes, okay?
okay, 30 marks all. Okay, I'm ready.
Okay,
Yeah.
you can start.
Okay, start. Good afternoon, ma'am. I'm Dr. Hassan Al-Timimi. I'm the pediatric registrar working here. Thank you for coming over. I'm here to take history about this year. Please, ma'am, can you tell me your main concern about this year?
Yes, good afternoon, doctor. Thanks for coming. I was waiting for you. I want to talk about my daughter, Lucia. How is she feeling now? I'm quite worried. I have to call the ambulance and I have to bring her to the emergency. How is she doing now?
Yeah, she is now well, but I'm here to take history about the Lucia condition. So
Yes,
please tell me how you concern about Lucia, why you first concern about her.
yes, doctor. When I went to her room in the morning, she was not in her conscious. She was like lying in the bed. I tried to awake her, but she was not responding to me. I have to call the ambulance. I have to call the rapid response team, and they have to come and pick her. And they brought us to the hospital. But then in the ambulance, she was fine.
Okay. If she had if she if she had fever,
No, no, she doesn't have any fever.
Mom, if Lucy have fever before that,
Sorry,
if Lucy have fever before that,
she had a bit of fever, and she had flu last night. Yeah.
yeah. And how can you explain me about her eating? Is she eat well?
Sorry, about what?
Her eating, drink, is she eat well or not?
Well, she's a bit of a picky eater, but normally she's eating. She's fine with eating. Yeah, she's not that bad.
Before developing her loss of consciousness, is she ate well or not?
Well, like I took her to her room last night as a routine, and I made her to sleep. And before going to bed, we had our dinner, like what we are taking routinely. And yesterday she had like some low grade fever, so she was not eating well. So she had left a bit of her plate. Otherwise, she ate nicely. Yeah.
Is she develop abnormal behavior before that, and during her loss of consciousness, it develop something?
Like she was in her room, she was sleeping. I let her to sleep, and in the morning when I went her to wake her up, she was not responding to me. So I don't know what happened in between.
Mhm, mhm. Okay, this is the first time happened to her, or is there previous?
Uh, last time, previously, she had one episode like this, but it was not like she was just sitting with me, and she went a bit drowsy. And then she was fine. I was about to take her to the emergency, but then she was fine, and this the second time happened.
That the first one happened when? Before how
Uh,
long?
it was like I will say roughly 6 weeks back.
Mhm. Is at morning or the same at night or
Yeah,
the same?
it was almost mid afternoon.
Yeah, yeah, exactly. Okay. I'd like to review her system. If she developed about ask about her poo. If she had loose poo or
No,
vomiting,
she
sickness.
no no, she was not sick. She was not throwing. No, she doesn't have any loose stool. No.
If she had seizure before.
No, she didn't have any seizure.
Yeah, yeah. No abnormal movement.
No, no abnormal movements. No.
Yeah. About ask about her. She have cough, uh, shortness of breath.
No, 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 no such thing.
Any previous hospitalization, please, mom?
No, she has not been admitted. She's very active. She's very healthy. She has never been admitted to the hospital. Like the routine things, she will get some flu and cough. I will take her to the GP, and they will give us some medicine, and she will be fine.
Does she take any medicine now or before?
No, she's not taking any medicine. No,
Any previous test you did to her?
no, no.
Uh, I'd ask about your pregnancy is going smoothly. How is your pregnancy, please, mom?
So it was a planned pregnancy, and I was regularly following with my doctor. I had all my scans, and they were normal as well.
Yeah. If you deliver vaginal or by cesarean section?
No, she developed it was a normal delivery.
Well, is she need admitted to the neonatal unit or not? She was full term or premature.
No, she was, like I said, she was born on time, and she was a good weight baby. And just they monitor her blood sugar at that time because she was big, and they were worried that she may drop her blood sugar, and they will remain normal. So she will stay with me all the time.
Yeah. And when is she discharged from hospital? How long she stayed?
Well, we stayed for almost 24 hours, and the next day we went home.
Yeah. Um, is she is her growth is okay? Are you concerned about her growth?
Uh, no, she's gaining weight. I think you mean to say that?
Yeah. And
Yeah.
she can walk.
Yeah, she can walk. Yeah, she can walk.
Yeah. Uh, and she had vaccinated. Is she full vaccinated or not?
Sorry, what?
If she is vaccinated, fully vaccinated for her age or not?
Yeah, she has taken all her jabs. Yeah, vaccine she has taken. Yeah.
If she has any allergy to certain food or medicine.
No, she doesn't have any allergy. No.
Uh, Please, ma'am, can you tell me about your home condition? Lucy live with home.
Well, I am living in a flat and it's quite well furnished and yeah, it's beautifully decorated.
Yeah. She live with
Yeah.
the mom and dad.
Dr. Lucia is fine. I'm getting a bit worried because one of my friend, her daughter, she had loss of consciousness, and then they brought her to the hospital, and then she was dead. So is she fine? Lucia is okay.
Yeah, yeah. Uh, if you have any siblings,
No, she's the only daughter I have.
if there is any domestic violence in home or something.
Doctor, I have been divorced from my husband recently, so I'm living alone currently with Lucia.
Yeah. Is there family history of same condition?
No,
No. No history of hypoglycemia, no.
no history of hypoglycemia in family. No,
Yeah. Does he have any surgery before?
no.
Okay, okay. Okay, thank you very much, mom. Do you have something to add, anything or something we forgot to ask about it?
Well, like I said, I had been recently divorced, so from last 2 months I'm living alone and I'm working. So I'm sending her to daycare. I don't know. Do you think like something might have happened at the daycare?
Mm. Do you have any financial problem or you have a disability living allowance or something like that, or you have social support?
5 minutes remaining. Well, I'm earning good. I'm working in a bank and I'm earning quite good. I'm living a good life. I don't have any financial concern. No, I don't think so I'm eligible for any allowance at the moment.
Okay, okay, mom. Thank you very much for your conversation, and very happy to meet you today.
Thank you so much, doctor. Thank you for your time.
Thank you, thank you. I'm already finished history.
Okay, so it's you took almost 10 minutes.
Yeah.
Okay, so just so can you summarize your history?
Uh, I take history from the Lucia, 13 years old girl with history of loss of consciousness and history of blue light illness before that. This is the second time for Lucia to develop this condition. Uh, there is no, she is a good development. She is thriving very well, and there is no family history of same condition.
Okay, so what do you think Lucia is having? Why she had her loss of consciousness?
I think Lucia, there is differential diagnosis. It could be hypoglycemia. She's have blue light illness, then she sleep, then at the early morning find her unconscious. Could be hypoglycemia. Could be a seizure.
Okay,
Yeah. Could
so
be febrile.
uh, what's the
Seizure,
top three?
febrile.
What's the top three differential for her condition?
decrease her blood sugar hypoglycemia.
Hypoglycemia. Okay. And second
Caesar.
and third.
Third, she is well, could be a CNS infection or but it is far away.
Okay.
Poison,
So
poison it could be poisoning.
okay. So how you will approach if Lucia present you instead of unconsciousness? How you will present to her approach to her condition? How you will manage her?
If she has, I test, I should, I did the ABC, airway, breathing, circulation, uh,
Okay.
and I did a random blood sugar for her.
Okay.
If she has, yeah, if she has hypoglycemia, if she has low sugar, I will manage her and I will take urine sample for ketone.
Okay.
Yeah.
Okay.
If she has,
So
yeah,
yes. Okay. Yeah. You can proceed. Yeah.
yeah. If she has hypoglycemia, I will start management of hypoglycemia.
Okay.
If she
So
has,
what's the definition of hypoglycemia in this age group?
run, blood sugar below 2.6 millimole per liter.
Okay. So how you will correct the hypoglycemia initially? If like she's playful now and she's walking around with you, so how you will manage the hypoglycemia?
Uh, if she's conscious and she can't drink, I can give her either glucosate or juice or I put sugar in water and give her. Then I recheck her after 10 to 15 minutes
Mm-hmm.
because the system may still the system lag behind the return sugar to normal. So if it is still hypoglycemia, I'll give her another glucosate or juice about 100 ml or sugar gel or sugar tablet. If it is unconscious, I give her glucagon.
Okay.
Yeah, this is regarding home management. While in hospital, if she came to her with hypoglycemia and unconscious, we gave her 2 ml of 10% glucose water,
Okay.
2 ml per kg of 10% glucose water, followed by maintenance glucose water of 10%. Then we follow her after 10 minutes, check the sugar again. If it is normal, we continue with her diet or give her milk. If it's still low, uh, we can give her hydrocortisone.
Mm-hmm.
And
Okay.
yeah,
Yeah. So
if it's,
investigation wise, like you have a child with hypoglycemia, what basic investigation you will do for her?
the investigation should be blood sugar first, urine for ketone, should very important. And I try to take from her in order to approach the cause of hypoglycemia. I should take cortisol, ACTH, uh, insulin level, and C-peptide.
Okay. And you said you will look for ketones in the urine, yeah?
Yeah,
Yes. So if there are ketones in the urine, what will be your next step?
if there is ketone in urine, this could be ketotic hypoglycemia. I should check, examine if there is liver, if there is a liver enlargement, if there is hepatomegaly or not,
Okay.
because if there is a hepatomegaly and insulin level is low, it could be metabolic disease. If there is no hepatomegaly uh, and the insulin is low, this could be ketotic hypoglycemia.
Okay, so if in Lucia case it's not liver is not involved, so it will be ketotic hypoglycemia.
Yeah, will be yes, ketotic hypoglycemia.
Okay, thank you so much. Thank you.
Thank you, sir.
Anything you want to add? No problem. Points. This is the good thing. It was a short history, no doubt. Like you finish early, but normally this history there's nothing more because it's acute uh, incidents and it will not last for 14 minutes. The things like I would like to talk about. I asked you two time how Lucia is doing, and you said yes, she's fine. You should have explained to me that yes, you have examined her. Like you have to add something extra so that you have to make the manager satisfied. Yes, that Lucia is fine. I asked twice this question from you, and you almost totally ignored my question, which is not like a good thing. You have to answer the question because she was concerned. I don't know
Yeah,
if I have seen Lucia or no. Maybe she is in the emergency room and I'm waiting in the outside room, and I don't know. So I asked twice this question in the start and in the middle, but you didn't answer. Then I said I'm
yeah,
divorced, and said you said okay, yes. You showed a bit of sympathy. That's most important. Like she said she's divorced, so you should have taken a pause. I feel sorry for that, and you should have showed a bit of sympathy for that. And
okay.
then I asked you like she started nursery recently. Do you think anything happened there? So you should have explored that area.
Yeah, should be
You
yes.
might have had a head trauma there, might be a mild one, and we don't know. So if mother raise a concern, you have to explore that area.
Yes,
Yeah,
yes, yes.
yes. Otherwise, you covered all the point. The history was good. Your discussion was very good. You reached the diagnosis. It was a ketotic hypoglycemia in my mind, and your discussion was very good. That's most important thing. Only you need to work on your sympathy and empathy, and try to listen to the role player, what she's saying, what she or he's saying. If they are asking any question, take a pause and answer their question.
Yeah,
If it's
yes,
important, it's good for the history. If it's not important and you think it will take a long time from you, just answer simple thing that let's finish this today, and let's finish it now and we will talk about it later. If you reply to these simple words, the examiner will not mind this thing because you have answered his concern, his or her concern.
yes, yes. Thank you very much. Thank you.
Okay.
Okay, thank you.
Any question from me?
Doctor, I want to ask this that mother said I'm divorced. So, like, how can we ask further that is it affecting Lucia or even mom? How can we ask this? Can we ask this question?
You can ask like you think he's missing her dad and she's not eating nicely. You think her
Okay,
it's affecting Lucia health,
okay.
but yeah,
And
don't
can
go into
we cannot
yeah.
ask like
So
what is the reason? What could be the reason?
no, no, it will be too much personal.
No,
Like
no.
if you no, you
Okay,
and yeah,
okay.
it will be like too much personal if you go to the reason that why you get
Mm,
divorced. Yeah,
okay,
so yes, especially in UK, it's like a common thing.
okay.
And here in
Thank.
UK, we don't use the word husband or wife. Here they are using word partner because you don't know if they are married or no.
Okay.
Yes. So I think
Sorry, 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 Dr. Zahid. I'd like to ask about the management of hypoglycemia. Shall I start with hospital management or the home management here?
well, it
Real,
depends on the examiner question. Like I asked you from hospital point of view, and your approach was good. That ABC, ABC is
yeah,
the best thing you will start with. Yes, if it's hospital management, then you have to counsel the mother how she has to correct the hypoglycemia initially before ringing the ambulance or ringing someone to take her to the hospital.
correct,
Yeah.
correct.
Yes, but your Viva was excellent. I'm impressed with the Viva. Only you have to work on your sympathy and empathy because I have written here as well. If you see that, don't ignore the questions.
Yes,
Yeah. because sometimes they will ask important questions. Sometimes that question might guide you to the diagnosis. Sometimes they will try to waste your time because they are trained role player. So if they are diverting you from the history or communication, just tell them simple, let's finish this thing now and we can discuss about this later. Because you answered their concern, you didn't let them down. Okay. Okay. I think if any question, then no, then we can go to communication.
Can I participate?
Actually, I think the people who've been volunteered and shortlisted already. We'll do another session, no
Okay.
problem. Yeah, I promise you. We
Thank
can
you.
arrange another session soon, if that's okay. I don't know who was the first one doing the communication. Sorry, it was Tariq and Zahra. I don't know if they are here or no.
Yes, I am available.
Sir, I'm here.
So who want to do first? Dr. Zahra, you want to do first or is the Tariq?
No issue.
Sir, I am ready. If you say
Okay.
I can do first.
So Anuradha is asking about GMC registration. After Dr. Anuradha, we are going to arrange a webinar on this very soon, and we will be talking about this thing in detail about how to do GMC registration. GMC by itself is easy, but Epic is a nightmare. So I think we are planning to do a webinar in next week or two, and it will be covering all the topics regarding the Epic and the GMC and OET. So that will be advertised soon. I'll just stop the screen share to just get this. Where is my comment? Rizal, you can see the communication.
Yeah, I can see.
You can read it, yeah? Sorry, I forgot to turn on the camera for the previous one as well. If you feel comfortable, it's up to you.
Sir, actually, I am in some setting where I cannot.
That's fine. That's fine. That's
So,
completely up to you. Just yeah. This is a communication topic. I will turn the timer for you. You can take your 3 minutes to prepare the topic.
Okay.
I don't know if this will be visible in the, but these are the points I have written for the history when while she's preparing. I used to do normally when I was preparing for my history. I will share the screenshot as well. Like the points I have to cover. Ready? Dr. Zahra, you are ready?
Yeah, I'm ready.
Okay, you can start whenever you want.
Shall I start?
Yeah.
Hello. Good morning.
Hi, good morning.
Okay, I believe I am talking to Miss Khadija, mother of Ahmed. Is that so?
Yes, doctor, I'm Ahmed's mom.
Okay. So nice to see you. I am Dr. Zara, one of the child doctor over here. So today we are here to discuss something about Ahmed's condition. So are you okay at this time?
Yes, doctor, I was anxiously waiting for someone to talk to me. How is Ahmed doing now?
Yeah, I appreciate your concern. He's now fine, and we have seen him, and he's now currently he's fine. So we have planned his further management. So I am here to talk to you about Ahmed's condition and our future plan. So, is there anyone else you want to attend this meeting with us?
No, that's fine, doctor. My husband, he's in office, so you can talk to me because I'm listening to weird things from the people around. So you can explain to me what actually happening with Ahmed.
Okay, that's fine. So we have made this arrangement, and so that you can ask anything in your mind, and we are here to clear all your queries. So, Miss Khatija, first of all, I just want to know that what do you know about the condition of Ahmed?
Well, like he was all right. I was outside with him. He's having vacation, so we were having a party time with my other friends, and he had some shortness of breath, and we brought him straight over to the hospital. And now, like they're saying that he's having some problem with the heart, which is like quite strange to me. Like he's very active. He's playing sports.
Can you hear me?
Yeah, so he's very active. He's playing sports. He's doing all active, having active lifestyle. So I don't know how he got this heart problem.
Oh, I can understand your anxiety, and I can understand your concerns. Yeah, because you know that sometimes some of the cardiac diseases or heart diseases this present like that when the patients present just they are playing or they are doing something, and then they suddenly lost their consciousness and suddenly develop this shortness of breath. Are you with me?
Yeah, I'm with you, but you mean to say that he was born with this problem?
Yeah, but I can clear you just like that. I am drawing a picture for you. Just if you can see that this is our heart. Okay, I am drawing this, and you can see that there is some the blood goes in like that, and this is the way how the blood coming out of the heart and is supplied to all the body. Are you with me?
Yes, doctor, I'm with you, but like if
Okay.
he's born with this problem, like he's now 15 years, so why he didn't have this problem earlier? Like we have going to our GP regularly when he's sick. Like why they didn't pick this problem earlier? Why after
Yes,
15 years?
your concern is very valid, Ms. Khatija. Actually, sometimes these diseases they present that when the kids are grown up. Like sometimes these diseases have no issue in the childhood, and whenever they increase their activity and whenever they become so energetic and all that, and they are playing, and these is diseases sometimes they are picked up later on. Am I clear so far?
Yes, doctor. I'm getting it. So what's going to happen now? He will need a surgery for this.
No, first of all, we will investigate properly, and we will see what is the main lesion, or what is the main problem behind that, and we will take on board our child cardiologist, and we will do some more tests on Ahmed, and then we would plan out what we can do further. Okay.
Okay, but like you said, you are not a cardiologist, yes?
Yeah, no, we have received Ahmed in this condition, and now we will they'll, execute some plan for him, how to refer him to the particular doctors who are expert in that.
Okay, so it's not sure that he's having heart problem. It might be something else then, because you said he still has to see the heart doctor.
Yeah, you can say that, because we are the child doctors over here, and some of the diseases which we can pick up, and we can have an idea that the child might have this problem, but for the confirmation and for the further their plan of management, we have to refer them to some expert persons. Am I clear so far?
Yes, doctor. Yes, you are clear. Yeah. So, how long it will take?
Yeah, we are doing some formal testing and all that, and after that we would make a referral letter, and we would refer him to the cardiologist.
3 minutes remaining.
Okay.
Okay, so like it might take long because nowadays I am looking that the waiting time is quite long. So what I will do if anything happen in future is like I'm not getting stressed up and worried. So what I will be doing in future? How to prevent
Yeah,
such?
I okay, okay, carry on.
Yeah. So how to prevent this thing
Okay.
happening in future?
Okay, Ms. Khadija, I really appreciate that you are such a concerned mother, and you are very good caretaker of your child, and you have very reasonable and valid concerns. So don't worry about that. We are here to help you out, and we will give you a proper plan, and we will give you our 24 hours emergency number and all that, and you don't have to be worried about it, because you would have a proper plan, and you can contact in case of emergency till he is being seen by some cardiologist, or some further their future plan is executed. Okay.
But doctor, I'm very like, is he going to die from this?
Miss Khadija, you don't have to take it like that, because all the diseases have if with treatment, most of the diseases have a good outcome, and then better is to pick them early, and to have a proper management. So luckily he is being picked now, and we are going to manage him. So I think have to be very hopeful in that case. He after management, he might be good. Okay.
Okay, and like, is there any special diet I have to give to him at home? Like anything I have to take care of?
No, there is not specifically he needs any dietary management apart from a good diet, healthy diet, and you should only avoid like the oily stuff, and the salt intake and all that, but our dietitian in the team would guide you better in this regard. Okay.
Okay, thank you so much.
Okay. Is there any other question you have, or may I summarize our session today?
That's fine. You can summarize, doctor. I have a lot of questions, but I want to see you again later on. No problem.
Okay, no problem at all. You can see me anytime. So, Miss Khatija, we have a session today, and I told you about the Ahmed's condition, and I told you that we are suspecting some heart problem in him, and for that, we are going to refer him to the pediatric cardiologist, and we have discussed with you all the things that can be included in in his future management. And if you want, Miss Khatija, I can give you some leaflets and some trusted websites or literature or material if you want to know about the cardiac diseases which can present with this loss of consciousness or syncopal attacks. Okay.
Okay, thank you so much, doctor. Thank you for your time.
Thank you so much, Miss Khadija. Thank you for coming.
Thank you. Okay, so it was good, Dr. Zahra, very good approach. Only few things. When I ask you, like, was he born with this condition? So first thing, you are not sure about the diagnosis yet because echo is not done. It's the job of a cardiologist that he to diagnose. So you have
Okay.
to tell her that we presume he have a heart condition. Looking at this blood pressure which we have measured, and there's some difference. So we presume that he might have a heart problem, but yet we have to confirm. And for that, we will be referring you to a specialist doctor. So if you use the word specialist
Okay.
doctor, it covers everything. Don't go to the specialty, cardiologist, gastroenterologist. Just simply tell her a specialist doctor.
Okay. Okay.
Yeah, we will be referring you to a specialist doctor, and he will be doing some scans and some tests, and then we will be sure that what actually he is having. The
Okay.
second step, if he asks you anything, any home take message, yes, so he has to avoid strength exercises. He has to avoid all the sports so that his body will not be under stress.
Okay.
Yeah, and when I asked why, if he has this problem, he was born with this problem, and why it presented now. So normally with body becoming old, our requirement, our stress level, everything increases. So initially he was not having any symptoms, but now he's 15-year-old. So his body requirement, his stress level, everything is increasing. So that's why it presented now.
Okay.
Yeah, and try after 3 minutes when they do a knock for the last 3 minutes. Try to take maximum 2 questions, not more than that.
Okay. Okay.
Yeah. Yes. Just because if you will not summarize, you will lose your marks. Because you took
Okay.
almost 30 seconds extra because I stopped. But if it will be in the exam situation, they will keep on talking because they want to waste your time, and they will leave question for the last 3 minutes. So take two
Okay.
questions, maximum 2 questions from them, and then just say, I can understand you have a lot of questions, but due to limitation of time, I will summarize this for you now, and we will have another meeting and we will discuss it in further details.
Okay. Okay.
Yeah, because examiner know the time is limited, but you have to cover like all the points. If you will not summarize, you will not give leaflets, so that will you will lose the marks for that.
Okay.
Yeah. Any question you have got for me?
No, sir. Thank you so much for your valuable feedback. I would like to thank you for this opportunity of participating in this webinar.
Yes. And if like the mother is worried, you can tell her we are always here to help you. You can come to us anytime.
Okay.
Excuse me, sir.
Yeah, just don't specifically tell you can come to me because you don't know tomorrow some other batch of doctor will be on duty and you will not be there. So
Okay.
maybe she will come and she will be looking for you. Where is Dr. Zahra? So you can just
Okay.
tell her you can find someone from our team who will be here to help you at any time.
Okay. Okay.
Okay.
Okay.
Thank you
Excuse
so
me,
much.
sir.
Yeah, sure.
I have a question.
Please.
Like in this scenario, it's like obvious that looks like a coarctation of aorta. So can we tell the diagnosis? If we come to the diagnosis, can we tell to the mother that most probably he is having this issue?
No, just simply tell him we presume that he's having a heart problem, but we are not sure what actually the condition is. For that, we are referring you to the specialist doctor who will be doing some tests and some scans, and then we will be having a diagnosis in hand, and we'll be in better position to explain to you in much detail.
Okay, so in any case, we should not tell the diagnosis. Like if it has to be.
Yeah, if it's mentioned in the scenario, you can talk about it. But if it's not mentioned in the scenario, no, you cannot talk about it because you don't know what the diagnosis is.
Okay, okay.
Dr.
Maybe
Zahid,
someone who was taking the blood pressure, they have not checked it rightly. The cuffs were not proper size. So you don't know.
Okay, okay.
Dr. Zahid, like as you said, the scenario is not clear about the diagnosis. So in
Yeah,
this case, if they are asking for the prognosis, like will my baby survive? How will be he after? What will the specialist do? So in that case, what will we say?
like currently Ahmed is doing well. We have examined him. He's fine now. But the exact diagnosis and his further plan of management will be discussed with you by the specialist doctor. And for that, we are working hard on it to get you a referral as soon as possible.
Yeah, but then this question, like you ask about how to prevent the further episode. If we
Yeah.
don't discuss the diagnosis, how we give what option we give for prevent the further episode if we don't tell about the diagnosis or not sure about the diagnosis.
Yeah. So for further episode to prevent until and unless she has seen the cardiologist, the heart doctor, she has to tell Ahmed that he will not do exercises, he will not go for play, because with that the body requirement changes and he might have another attack. So till we get the diagnosis in hand, he has to avoid all the stresses and exercises and everything.
And sir, what does if she asks that can he go to school?
Yeah, he can go to school. Yeah, he can do all the normal activities at school.
Okay, but I have, as far as I know, they are saying that nowadays they are giving the scenarios and communications in which they expect us to make a diagnosis. Is it so?
No, because
Okay.
at registrar level, they're not expecting much from you because you are covered with consultant here all the time. And like I'm working in neonatology. So even I have a 1% doubt, like I'm working a surgical unit in neonatology. If I have 1% doubt of surgical, I will call the surgeon and he will come and he will diagnose it for me. And
Okay.
like I was working in Dubai. So if there is perforation in abdominal X-ray, we will pick that and we will do everything. No, in UK, I have to call the radiologist. He has to give me the diagnosis. Even the surgeon, they will not take they will not give any comment on the X-ray.
Okay, sir. Okay.
Yes.
Like I have seen the scenarios of interception, and if a child come with a scenario of interception and diagnosis is not written in the scenario, but it's a
Yeah.
clear case of interception, so we are not supposed to tell the mother that we are suspecting an interception, and it's like this, that one part of a gut gets into stacked up into another part. So how can we make a diagram then, sir? How can we explain with a diagram if we don't tell the diagnosis?
Like if like it's interception, it must be written in the scenario that you are suspecting interception.
Yeah, but I have seen scenarios in which it's not written, and like I have been doing it like that I am supposed to tell the mother that it is interception, and I have to draw like it happens like this in the gut, it happens like this, and now the surgeon has to further evaluate and further do the surgery or whatever like he feels best to do.
Yes, but unless and until you have a confirmed diagnosis written in the scenario with you, you cannot tell the mother exactly what actually is happening. Like it can be something else as well. Like for example, this case, it can be coarctation, it can be aortic stenosis, it might be someone they didn't check the blood pressure properly. They use different cuff in different places and they didn't place the cuff properly. Some of the cuff they might have put a bit tight and other were loose.
Maybe the sizes were not
Yes.
proper.
So yes.
So like to be on the safe side, we should not tell the diagnosis. We should just counsel.
No.
Okay.
Yes. Unless and until it's written.
Okay. Thank you.
Yes. In this scenario, it was in my exam when I was doing MRCPCH clinical, and the mother, she was continuously emphasizing on surgery, whether you will be doing surgery, and I was continuously denying that because I don't know what the diagnosis is, and I was focusing on that. The specialist doctor, he will come and he will talk to you, he will do scans, And once we have a
Okay.
diagnosis in hand, then we will be in better position to tell you which side will proceed.
Okay. Like
Yes.
to be on the safe side, we just have to keep counseling her that it's not our job to tell you the diagnosis or to tell you actually what has happened.
Yes.
It's the
Yes.
specialist who will be guiding you. Okay.
Yes.
Got it.
Yeah.
Thank you.
Yes. Because our confidence will kill you. If you tell, like, sorry, I don't know, I will read about it. Even if you tell the examiner during the main viva, sorry, I don't know, I will read about it and I will come back to you. So no, not come back to you, but I will read about it because I'm not sure what the answer is. He will not mark you down for that. But if you will tell him something from your side, definitely he will cut the marks for that.
Okay.
Yeah.
Yes, got it.
Excuse me, sir. Hello.
Hello. Yeah, sure.
Yeah, sir. I just want to ask. Still, if there is something to say, like mother is saying that if still she's not satisfied or she wants to ask something again, still we can offer that you can come back to us anytime and we will explain to you in another meeting like that.
Yes, you can tell her, and if she want to see your consultant, you can tell her, no problem. I can arrange a meeting for
Okay.
you with the consultant as well.
Okay. Thank you, sir.
If no further question, we can go to next scenario.
Dr. Zahid?
Yeah.
Dr. Zahid, thank you very much. I was just noticing, and maybe correct me if I'm wrong. I think the doctor didn't check the knowledge of the mother. That she should ask the mother like an open question that, ma'am, do you know about heart diseases, or have you read, or is there anyone in your family like this? Should we include like this? Because I had attended one class in that they were discussing that, yes, we should, ask open question and check the mother or like the patient, attendant, what they know about the disease. Like in this scenario, we have differential, but as we are talking about the heart diseases, so can we put an open question for the mom like this?
So normally in communication, they don't like you questioning them because you have to explain the condition, but asking a question or two, it's fine. Like you can ask her, have anyone from my team spoken to you, or what actually he's having? Like I replied to her that I'm listening to weird thing that Ahmed is having heart problem. So she has asked me that anyone has spoken to you, like might be someone else has spoken to me about Ahmed as well. So she might have confirmed at that point, yes, that has anyone from my team spoken to you about Ahmed condition, or you have any idea about Ahmed condition? So you can ask such questions, but normally too many questions try to avoid asking in the communication.
Okay, thank you.
Yeah.
Sorry, sir, I have one last question.
Yeah, sure.
Not regarding this scenario, but I have one confusion regarding the communication. Do we have to ask the mother that do you want someone to be with you in this discussion? Is this the question only to be asked in breaking a bad news or in every communication?
In anyone you can ask them. You want your partner to be with you in this communication. You want your
So
partner to join.
we should offer in every communication scenario?
Yes.
Okay.
Yeah. If no further question, we can go to next scenario. I think HK is asking something.
Yes, sir. I want to because just before me Dr. asked the question. So I heard that if you are dealing with a critical incidents or you are talking to the younger, at that time you can't say, is there anyone? So what is your opinion?
Sorry, sorry, Riaz, you can repeat your question. Sorry.
Because just you told sir that in every scenario we can ask about attendant, but I heard that in case of critical incidents or in
Teenager.
case of when you are talking to the young,
Yes, in teenager.
in that scenarios you can't say about, because
Yeah, in
there is a
teenager, yes.
confidential issue.
Yeah, try to avoid in teenager, because if you will offer them, if they want someone to join with them, like their parents, so here they don't think it like it's good. You are not trusting them. So in teenager cases, try to avoid them, because in UK the teenager, they are independent peoples and they like to do everything on their own.
Thank you, sir.
If Dr. Tariq is ready, so this is the next scenario. I don't know if he can read it.
Yes, yes.
The Tariq can read it completely. The names, they are not bothering you, yeah, on the side.
No, it's okay. I can read it.
I don't know how to minimize it.
इसके साथ चार्जिंग के साथ चल रहा है.
Ready?
Yes, Dr. Zahid.
Okay. You can start.
Hello, good evening. I'm
Good
Dr.
evening.
Tariq, one of the children doctor. I believe I'm talking to Ivana.
Yes, Dr. I'm Aviana.
Okay, Aviana, welcome. Aviana, today I'm here to discuss about your baby that is coming soon. Aviana, is it the right time to talk about it now?
Yes, doctor, please. I was waiting from someone of the baby's team to come and talk to me. I'm quite worried about my baby because I had 2 previous baby loss. So I really want this baby.
I'm so sorry to hear about that, Aviana. I can understand it's quite a difficult time for you, and I'm so sorry, like, to talk in such a situation.
Thank you, doctor. I can understand, but I hope everything goes well this time.
Miss Abiana, like as you know, like the baby is preterm, and do you have any knowledge about the preterms? Any experience before?
Like one of my friends, she had a baby born before time. It was 2 weeks before time, and their baby's fine now. So I hope my baby will be fine as well.
Miss Aviana, I can understand your worries. Let me tell you that any baby who is delivered before 37 weeks, we call them as preterm. And these babies, like in your case, you are 24 weeks now. And as I came to know, like you have some previous abortions, so I really feel sorry for that. But we are here now to discuss that what will be the outcome for 24 weeks and what will be our plan.
Yes, doctor. So, what do you think? Will she able to survive?
According to the UK national data, I will inform you that 24 weeks, usually around 50% of them have survival, even less than 50% survive. But in these cases, recommendations are that we will, when the baby is delivered, there will be a neonatal team at the delivery, and we will assess the baby, how the baby is doing at that time. It is very important. And we will assess whether the baby is responding to the initial steps that we will do to support him during breathing. As you know, like these babies have some difficulties at birth.
Yes, yes, doctor. Yeah, the midwife, she was talking to me quite a while ago that yeah, the baby might have some problem with breathing.
Yes, you are right. I'm happy that you had a meeting with them. Ms. Abiana, usually these babies, the preterms, they have problems starting right away from the birth, and they need support even at the time of delivery. So we will be there to support the baby, and we'll see like how the baby is responding. We will respect your wish that you want this baby, but also at the same time depends on how the baby is responding.
Okay. So, doctor, what challenges my baby might have when she is born?
Yes, Miss Abiana, that's an area we are here to discuss about. The preterm babies, they usually, as I told you, have some breathing difficulties. Their lungs are immature, okay, and they sometimes even need some breathing machine to support their breathing. And
Okay.
yes, and the vision and the hearing is affected because of the prematurity of all the systems. Okay, so we have repeatedly to monitor them for vision, for hearing, and feeding difficulties. They have some feeding difficulties and catch-up growth. Like these are the difficulties initially they are having. So are you following me, Miss Aviana?
So, doctor, from your experience, like you might have seen many babies born at this time, uh, how severe her breathing difficulty will be? Because the midwife, she was talking that they might have to put a tube in her mouth all the way to the lungs to support her breathing, and she will be on the breathing support machine for a while.
Yes, Miss Ivana, I can understand your worries. And yes, as I told you, their lungs are immature. So some babies, when they deliver, they do need support in the form of this tube that we put in the air pipe, and it goes down, and we usually give them support by the machines. So at this time, it's very early to tell you how will the baby need and what will be needed at that time in the form of this support. So once the baby is delivered, he will be assessed, and according to his situation, we will proceed.
Yes, but doctor, the my specialist doctor, she was talking that the steroid injection which they have given to me will help this lungs to be mature. So still
Uh,
she needs support for breathing.
Yes, Miss Abiana, I came to know that you had steroids before delivery, and they are helping in the maturity of the lungs. Okay, but this also depends on how many doses you have taken and at what time you have taken. So, in summary, I will tell you that yes, there are some factors which will help the maturity of the
Three
baby,
minutes
but
remaining.
but okay, but the most important for us will be once he is delivered, we will be in a better situation to decide and discuss it with you again.
Okay, doctor. And doctor, for if everything goes well, so for how long she will be staying with you?
Yes, that's Miss Saviana, most of the preterms, they stay here like for long times, even like for months. Okay, and like during these days, all the problems that they are arising, we will be following for that, and we will intervene once we see any problems at that time. So like the stay will depend on how like things are going. Like most of the time they stay for 3 to 4 months.
Okay.
Uh,
And doctor, what about feeding? Like, what you will do with her feeding?
Ms. Abiana, regarding the feeding, initially, we will not be able to start feeding immediately. Okay, and once he is stabilized in the initial stages, and we will start him with some feeding through the veins, which we call the TPN, the parenteral nutrition. So we will provide him energy in this form, and later on, once we feel like he is doing well, we will start him with some feeds in the form of breast feeds, which we can give through some tubes, and we can discuss about it later on.
Okay, doctor, that's fine.
Ms. Abiana, like we have talked in details, and I know like it's quite a big topic and it's difficult to cover in such a small time. So if you have any questions or queries, we can set another time and can arrange to have some more details about it.
Thank you so much. That will be so kind of you.
So let me just go through the important points that we have discussed, that your baby is quite a preterm, 24 weeks, and he has more risks of having the problems associated with this preterm delivery. He will need support starting right from the birth, and we agree now that he will be given support once he is assessed at the delivery, and there will be a neonatal team available at that time. And once the baby is stabilized and the clinical condition is clear, we will sit again and discuss about the outcome of the baby again in detail.
Okay, doctor. Thank you so much. Thank you.
Meanwhile, I will give you, Aviana, some references and some trusted websites which you can go through and have details about your coming baby. And I hope you are well soon.
Thank you.
Thank you
Thank you
so
so much.
much. Still time left.
No, time finished. Yeah, time finished. Sorry. So this is the general outcome for the paper which we used to give to parents whose babies are born between 20 to 26 weeks. So 24 weeks, generally the 4 in 10 babies, they die, and 6 in 10 babies survive, with 1 in 7 babies have severe disability, and 6 in 7 they do not have any disabilities.
Do we
Okay.
need to know this?
Yes. Here for any
Like
counseling
if
between
any other, like if there is any other scenario in which we don't know the figures, then what to
don't
do?
talk about the figures then. Don't talk about the percentages. Better to avoid the percentages. If you don't know exact figures, don't then try to avoid that.
Okay.
Yeah, try to avoid giving false information.
We
Yes,
have
and
to tell the mother about this information, that this is the chances of survival, and
yes, if you got a 22 weeker and the parents they are insisting, and you think that the outcome is bad, so then you have to give, like for here any baby, we are going to counsel them regarding the outcome. We give them a copy of this BAPM. This is British Association of Perinatal Medicine. We give them this this chart.
okay.
Yeah. So Dr. Tariq, was good. I think you didn't ask about the partner, yeah? If she want her partner to be with her during the discussion, because this is important time. Her partner need to be with her.
Yes, I did not ask.
Yeah. Yes. And like she had concern, she has questions. So you should have asked her. You want me to walk through you want me to walk you through from the beginning. You have any certain questions so that we can go accordingly. So if you have asked me these things, then I would have given you question that these are my concerns. I want to clarify that rather than going from A to Z.
Okay.
Yeah. Yes. So otherwise it was good. Yes, but you should have given her option. Yeah, either you want to lead the talk, or you want her to lead it. So that because it's a big topic, it cannot be covered in 9 minutes. Sometimes these discussion it takes more than 30 minutes for us when we are with the parents in a real situation, because the number of questions they have, like it takes more than 30 minutes for us to answer all the questions. But if in case she's letting you lead the discussion, so talk about everything briefly. And the initial problem, when the baby is born, they have problem with breathing, and we will have to support that breathing. The good thing is that you have received steroids, which will help in a bit of maturation of the lung, but still they may have problem with breathing, and for that we will be supporting them. And once the baby is born, we will be in good position to know that whether that support will be from the nose, whether to support the breathing from the nose with a machine, or it will be through the tube, which will be passing all the way from the mouth to the lung. And if in case we have to pass the tube, we might be giving a special injection to make the lungs more mature, which we call surfactant.
Yes.
Yeah. And then they have problem with temperature stability. So we will have to keep them in a special double insulated glass container bed, which you can see, or your partner, if they want to visit us up to our unit, we can show to them. They will be staying there for quite a while, and we will be maintaining the temperature and humidity so that they cannot lose a lot of nutrient from their body, and they cannot lose much of weight. Yeah, especially then you have to
Excuse me,
talk
sir?
about. Sorry.
Yeah, in this scenario, as you mentioned, we are talking about the respiratory problem which we encounter. Should we
Yeah.
mention all the problem, the extreme preterm develop one by one, like cardiac PDA and intraventricular, and breathing in the brain and kidney, immature kidney. So all the skins immature. So everything we have to tell in step
Everything
by
we
step,
cannot
or you
cover
have
in
to
9
mention
minutes.
mainly the focus on respiratory system?
No, we cannot cover everything in 9 minutes. The most important things, like a preterm baby, when they are born, the initial thing, they have problem with breathing. They have problem with temperature and stability. They have problem with the nutrition. So at least these 3 bits you have to cover, and you have to cover them with the infection as an antibiotic as well. So these 3-4 things you have to cover at least. Like I mentioned, if we go in detail of this discussion, it will take more than 30 minutes for all the talk to finish. But the initial problem, like they can have IVH, so it's a later thing. It's not like they will get IVH on the first day. But on the first day, they will have problem with breathing. They will have problem with temperature. They will have problem with nutrition, for which we will be putting either UAC, UVC, or we will be putting a peripheral line or a PIC line and give them nutrition. So at least these 3-4 things, the most important thing, you have to talk to them so that they will be aware. Because later on, they will be keep on visiting you to the unit. So the PDA, it will not happen the first day.
Okay, okay.
Yeah. Any other question?
What are your comments, Dr. Zahid?
Yes, it was good. You answered my concern, but I had. You didn't let anything of them, you didn't let me down. You answered all my questions, and you were polite, you were sympathetic.
Recording in progress.
Sorry. Yeah, so you were sympathetic, and you were listening to my question, you were giving it pause. So it was good. Any other question from anyone? I think we are soon arranging another webinar about the GMC registration, the EPIC verification, because EPIC is a nightmare. So any one of you who are in line of preparing for GMC registration as well, so we will be talking about that. And I think we can arrange a few more webinars soon about about the mock that you can poll whether you want to do history and communication, or you want to do videos or clinical. But most of us, we suffer with history and communication rather than clinical. And yeah, video is a bit like video you need to be systematic and you need to talk about it. So I will let them put a poll, whatever you want. So if you want history and communication, we can do another webinar on history and communication. We can look for other volunteers who are appearing in the exams. Or if you want videos and clinical, so we can do that. Development is the most easiest station, Babar. Don't worry about that, especially after I think now still there is no role player, so it will be with the examiner. So I think development is the most easiest station to get 12 marks. I will give you the history. I will search the history I wrote for myself when I was giving the exam. So I will share that history with you. Believe me, if you do it properly.
Yes, please, sir.
Yeah, and video as well. I think everyone should aim for 12 from the development and 12 from both videos, because videos cases will come from emergency, most of them. So videos, we can do videos, no problem. Videos are easy.
Zahid?
Yeah.
In such scenario, do we really need to draw some sketch? I mean, just talking about maybe how we will give the servanta, or what do we mean by UVC, UAC, or how we will be, because when I was reading one of the book, they are talking about, the sketch that you have to draw something for the, for the patient to understand. So in this scenario, should we do something like this or no?
It's always good to draw, but I don't think so. Like in such a scenario where you are limited with time already, where you cannot cover each and everything. So if you if you start drawing, so you will lose important bit. Like if it's a scenario about a specific thing, like interception, one of them said, like or VSD or PDA, it's a good thing to draw because you are talking about only one thing. It will give you extra point. But talking about a big thing and then drawing, so it will waste a lot of time from you.
Okay, thank you so much.
Sir, regarding long case history, I want to ask something that can we skip the systemic review in taking history for long case?
No, try to take it. If you will skip, so you might miss important bits in that. And especially nowadays, they are not bringing big history. Most of them are acute scenarios. So 14 minutes are more than enough. You can easily cover if you practice.
Okay, so where we have to put systemic review, or we can change the order or sequence?
There is no specific order. You can change it. But it's good if you take the chief complaint, then go to the past. In the past history, you cover the systemic review.
Sir, I would like if you take some development classes.
Yes, definitely. Someone asked about it as well. So I wrote this history. I don't know if you can see the screen. Development, we are arranging. So if you want, we can take another mock for development, and we can combine video with that, because development is a big station, so it's time consuming. So I'll just talk with my colleague, and if they are happy, we can arrange another the session for development along with the videos.
Okay.
Yeah.
Sir, can you share the development history pattern which you said that you made for yourself?
Yes, definitely. I will share it in the group. Yeah, you will get it.
Okay, thank you.
Yes. Yeah. Any question, any worry you have? If not, then we can take a break then.
Dr. Zahid, are there any other scenarios you are going to do?
No, it was all for today.
Okay.
Yeah. And yeah, we will be arranging a course as well, a formal course in which we'll be covering all the stations. It will be almost 45 sessions, which will be conducted by me and by Dr. Mamoona and Dr. Rabia.
Dr. Zahid, you are planning to do a history session soon, or?
Yes, I will just talk with my colleague. If they have not planned anything sooner, then we can arrange another mock. Either it will be history or it will be a development, complete development session with history and examination in Viva, and along with that we can do videos as well.
We need a history, if you can.
Okay, so we can do development and history then. We can skip videos for now.
Okay.
Yeah.
It's better. Okay,
Yeah.
thanks so much.
No problem. Welcome. So if no more question, then we can take a leave then. I think so. Thank you so much everyone for attending the webinar, and I hope it helped you somehow. If you have any question, you can leave in the group and they will come to me, and I'm always here to answer that. And if you want to practice any special system or station, just leave in the group, and once I get the message, we'll arrange a webinar for that, free webinar for that as well. We'll do a
We
polling.
want to do the autism developmental stations.
Okay, sure. Just let's put a poll, and we can see if people want to do development and history, we can do development and history next one. And if they want to do development and video, so we can group up something together and we can do that.
Okay, we'll be waiting for the next class. Thank you, sir.
Sure, definitely we'll arrange that.
Thank you.
Okay, thank you so much, everyone. Thank you. Bye.
Thank you so much. Thank you.
Thank
It
you.
was a
Thank you,
nice
Dr.
session. Thank you, sir.
Bye.
Thank you.
Thank you so much. Thank you. Bye-bye.
Thank you. Bye.